of Congress. Today, my partner Kia and I come before you with the petition for increased funding towards the treatment and prevention of malaria.
Before we get too ahead of ourselves, let's set up the scene for this easily preventable, potentially fatal disease. Malaria is fatal in 1 in 500 cases, and with further treatment, our goal is to reduce that number to 0. With increased funding for materials used for prevention, we can reach areas in third world countries where they are not accessible.
Spread by an infected Anopheles mosquito. Once the mosquito is infected, it infects other human beings through biting. This disease is passed through the blood. Parasites invade and destroy the red blood cells. Malaria is most common in subtropical zones such as Africa, Asia, and Latin America, because mosquitoes are most abundant in these climates.
Once bitten by the mosquito and infected with malaria, a person may experience chills, muscle aches, headaches, nausea, diarrhea, anemia, and jaundice. Fever is a common symptom because white blood cells try to fight the infected parasite, the red blood cells.
Experienced any of these symptoms and has recently traveled to a subtropical zone, they should seek medical care immediately. The doctor is able to diagnose a disease based on a combination of the patient's history and blood tests. The history is crucial and includes dates of trips abroad. The doctor looks at a blood sample and it can be determined if a person has malaria if one of the 4 malarial parasites is found in the blood.
Malaria can be easily treated with a combination of drugs given either by mouth or injected through the veins. The specific drug given depends on the type of malaria, source of infect, age, and the severity of the symptoms when treatment begins. The most severe type of malaria, falciparum, must be treated by hospitalizing the patient. All other types of malaria can be treated by chloroquine by the mouth. Falciparum has formed a resistance to chloroquine. In addition to being hospitalized when diagnosed with falciparum, you need to be given anti-malaria drugs over a given period of time. Along with chloroquine, primaquine might be given in order to prevent relapses that can occur during the recovery period due to parasites that may reactivate even months later.
Fatal disease, especially in tropical parts of Africa. In fact, 90% of malaria deaths occur in Africa. This is because Africa is stricken with poverty. They cannot afford simple prevention materials to avoid being bitten. We hope that you will fund our foundation to help distribute mosquito nets into poorer countries, like Africa, to reduce the amount of people being bitten and infected.
In order to prevent malaria, many things can be done. The one thing a traveler must remember to do is avoid getting bitten. The use of mosquito nets is a very simple and effective way to prevent the disease. Also, it is important to know when it is appropriate to be outside. If you are out during a peak mosquito feeding time, or dawn or dusk, there is a much higher chance of getting infected. It is important for travelers to remember to wear thick clothing when traveling and to take prophylactic medication before, during, and after traveling to another country where malaria is abundant. Although an infected person is able to recover from malaria, it is very difficult to completely get rid of it. Completely getting rid of malaria is a lengthy process. There are many complications that must be taken into account during the recovery period, one of which being that the parasite may remain dormant in the liver for months or years, and the disease may return after treatment. Children are more prone to experiencing these complications. During their recovery, and the destruction of red blood cells can lead to the development of anemia, a blood condition in which there is a decreased hemoglobin, and jaundice, yellowing of the skin. On children, anemia can have many long-term growth and developmental effects.
As you can see, malaria is an easily preventable and treatable disease. However, poverty prevents people in countries like Africa from accessing the basic materials required for prevention and treatment. We hope that you will fund our foundation to help poorer countries have access to the medicines and mosquito nets that help prevent from being bitten by mosquitoes. We will also supply them with medicine required for the treatment of malaria.